Each year, on the 5th of May, the World Health Organization celebrates the Save Lives, Clean Your Hands campaign. It is a day focused on increasing safety in healthcare through improving hand hygiene and reducing healthcare-associated infections. The subject of this year's campaign is surgical site infections, with particular focus on ensuring clean hands from the moment the patient enters the hospital through surgical preparations and postoperative care and until the patient is discharged. Infections that are caused by or associated with healthcare happen every day, and it affects hundreds of millions of people worldwide. Healthcare-associated infections cause avoidable harm and suffering for patients. They prolong hospital stays, they increase financial burden, and sometimes lead to long-term disability or even death. The prevalence of healthcare-associated infections in several countries in the WHO Eastern Mediterranean region is reported to vary from 12% to 18%. And this means that for every 100 patients admitted to hospital, as many as 18 may acquire infection during their stay. And this is rather high, considering that the pooled prevalence for all countries is only 10%. Clean hands have the potential to save 8 million lives worldwide every year in hospitals alone. An adequate hand hygiene makes the health system a safer place to receive care. Surgical site infections are the most frequent type of infection in low-income and middle-income countries, with a pooled incidence of 11.8% of surgical procedures. In contrast, surgical site infection rates vary between only 1.2% and 5.2% in high-income countries. And although hand hygiene is a very simple action, yet several studies around the world have shown that only around 40% of healthcare workers follow the standard hand hygiene practices. And in this respect, health workers have reported a variety of unjustifiable reasons for this. For example, that they lack guidelines and knowledge, that they do not have enough time, that attending to patient needs is more important, that they forget, and even that they do not have cleansing facilities. The report of a multi-country study conducted in 54 low and middle-income countries concludes that 35% of healthcare facilities still do not have soap and water for hand hygiene. These excuses are simply not acceptable. And for this reason, I urge all healthcare workers to increase their efforts to ensure hand hygiene, and all healthcare facilities to join the Save Lives, Clean Your Hands movement. Let us all commit to improving hand hygiene practices and help save more lives. It is important to remember that prevention will reduce the avoidable burden of healthcare-associated infection on health systems and ensure every healthcare setting is safe for every single patient. And in our region, 1,480 healthcare facilities in the 22 countries have registered for the Save Lives, Clean Your Hands campaign. This number demonstrates ongoing efforts to promote safer care, but it is not enough. This number falls far short of what should be done. It needs to be substantially increased during 2016. Thank you.